Welcome to Dental Business RX. Practice success in 30 minutes or less.
Thank you for calling ABC Dental.
Do you want to improve your treatment presentation skill set and potentially your treatment acceptance? Yeah, I know it's one of those dumb questions, sort of like, would you like to have more money? In any event, I assume you answered yes to this question. I mean, I'd answer yes to it. But I ask it because a funny thing happens when you're training a group of people at the same time. It's just something that I've observed over the years. I've been one of our primary speakers at the MGE Communication and Sales Seminars. We've lectured to over 100,000 dentists and their teams. And what this peculiarity that occurs has to do with the fact that no two people are the same. We're all different to some degree. You could even people out by background and education. I could be lecturing to a room of licensed dentists. They all have a degree. But when you take something like sales training or any interpersonal training, which is very implementation heavy, not everybody is at the same point or stage with relation to implementation. As such, you'll see a disparity in application. Many do really well, some pretty well, others okay, and a small few need additional help to get over the proverbial hump. And I think a lot of teaching, especially when done to a group, runs into that. So for this week's episode, I wanted to dig into this application issue, especially on the subject of sales, treatment presentation and acceptance. And I plan to provide a number of tools and ideas you can use to bust through any barriers you might have with regards to application in this area. So regardless of what stage you're at with relation to selling, you, your office manager, your treatment coordinator can use these exercises to improve performance, potentially see an increase in treatment acceptance, which is awesome because that always translates, in many cases, to healthier patients. My name is Jeff Bloomberg, and I'm your host. And we've all seen this to some degree. You have 5 staff that you're trying to train on how to handle a new patient call. And a few of them are just dead on. They do exactly what you teach them. One doesn't quite get it, and the other one answers the phone doctor's office, right? They need a lot more work. And how do I see this? But the point being is all of those people are trainable, just as an aside. They're all trainable. One requires more work than the other. And I think we all have areas like this. There are areas that I'm quicker on the uptake in than others. But let's say you've seen this before. How do I see it? Well, I could get in front of a room and I could say, the doctor should establish rapport with a new patient. Let's say you're doing a new patient treatment presentation. I could say you're supposed to establish rapport, explain the findings in a relatable way, show them what's wrong, explain what you want to do to fix it, with the whole treatment plan, tell them what's involved, in this treatment plan in a very relatable way, answer any questions or handle any concerns, explain what happens if you don't treat it now, why you don't want to wait, why we don't want to just do what insurance covers this year, make sure the patient wants it, and tell the patient the fee. And of course, your treatment coordinator is here for this whole presentation while you're there, so they can pick up on anything and you can pass them over to the patient over to them. And then you'd handle any objections. Then you get the patient on board. They're going to go off with the treatment coordinator and finalize financial arrangements. And you might even plant a little seed on, when you want to see them. I only do these procedures in the morning, so when's my next morning appointment available? Okay, day after tomorrow at 9, can you be here? Okay, great, I'll let you go off with Sally, and you guys will work out the finances. Look forward to seeing you then. No more questions? Okay, great. I could say this to a room of 50 doctors. I could also explain more complex sales or communication techniques, how to handle certain objections, etc., or how to structure the presentation, and what would happen. Because I've even done some of this on the podcast. Well, quite a few would just go home and do it. And, if they were coming to one of our seminars, we start our seminars off with wins from the last seminar. They'd raise their hand and share a win. I closed this case. I had this patient who didn't do this treatment plan the last 3 times I explained it. Now they did it, etc. With about 20% of the group, maybe 30%, I might see a bit of a mix in response. Some would do parts of it and see some results. They explained the whole treatment plan, but they didn't want to discuss fees. They didn't feel comfortable, or they didn't feel comfortable handling this objection. A couple might not make themselves very relatable. A patient asks why they can't do a filling instead of a crown, and they explain, due to undermined cusps, a direct restoration won't provide adequate structural integrity. Instead of saying a filling patches a spot, a crown protects the whole tooth. Without, the tooth can split, and that'll cost more to fix. In other words, they aren't super relatable, right? And then A few others I might find out later are completely uncomfortable even meeting a new patient. They get anxious, upset, nervous. They don't look at them when they talk to them, etc. So you can see the quality of how this basic advice, or if I give more complex information, is applied, has a lot to do with the person themselves applying it. I mean, for example, if I have a person who has difficulty meeting a new patient, they feel completely uncomfortable, like a fish out of water, how are they going to handle objections or discuss fees? We're not even there yet, right? How is somebody who's deathly afraid of discussing money going to tell a patient how much something costs? Do you see? Now, assuming the person truly understands what's being taught, which is a whole other issue. And I went into this issue in detail in episode 172. This was a little while back. That episode was called The Barriers to Study. But assuming they understand, then these issues are easily resolved. But that said, someone not finding immediate success might immediately zero in on, well, there's just something deficient in me. I'm not cut out for presenting treatment. I'm never going to be good at sales. I hate it, which is incorrect. If you can be taught, you can learn to do anything. And, sort of the proof that you can be taught is, especially if I'm lecturing to a licensed doctor, they obviously were able to sit for 4 years and learn to be a dentist, okay? So you can be taught if you have the a good amount of determination. It's just some people need a little bit more work than others. And again, we all have things like this. We pick up on some things better than others. It's just human nature. There are things that I've mastered which, you would think I never would have. It just took a lot more work with me than maybe something else that came more naturally. So with that in mind, I wanted to kind of look at this from the sales implementations perspective. And it's a little bit of an interesting episode in a sense because you may not fit in one of these categories, or you might. But let's look at the common problems I see when doing sales training. And I've broken them down into 4 major categories or scenarios, and I'm going to cover each of these and how I would resolve each. So let's take scenario 1. The person just doesn't feel comfortable meeting or talking to people. Maybe they get nervous, they don't like it, it's just not something they want to do. They just want to do dentistry. They don't want to meet new patients, they feel uncomfortable, they feel weird, whatever it is. Or even just approaching and speaking to people. Well, ultimately, that is a communications issue. And, I'll just tell you straight up, the solution for that would be, we deliver a communications course. So this is first shameless plug of the episode. We do a communications course. It's 4 days. There's a little bit of theory, and then it's all practical learning. And the end result is a person feels comfortable communicating and can control communication. And I think everybody should do it. If you're interested in something like that, I'll put a link for a consultation on the episode webpage because you should talk to somebody first to see if you'd be a good candidate for that. But what do you do in the meantime? You're listening to this and you go, God, this is me. I don't feel good meeting or talking to people. Well, I would suggest that you drill it. And you're going to hear this word quite often through this episode, drilling. And I think it's something that's completely underdone. What do we mean by drilling? Well, it's also been called role playing. You can call it any exercise, whatever you want to call it, practical exercise. We call it drilling. Basically, you take a skill that you want to perfect and you work on it in a controlled practice situation until you have the confidence to go try it in the real world. And when I say confidence, you may go out and try it for the first time in the real world, completely nervous, but at least you have an idea of what you're going to do and you're not caught flat-footed. And drilling is completely underdone in many industries, especially in dentistry, but it's not just limited to dentistry. But I'll give you an example of this. If I had somebody answering my phones, I would first have a pattern that they follow. I would have them drill the pattern by themselves, do it over and over and over again until they got it. Then I would have them drill it with one of the staff, maybe the office manager, in different scenarios. And I would make the scenarios very easy to begin with, and then I would make the scenarios more and more complex till the person felt confident before I put them on the phone. Because then they're not going to be caught flat-footed. Now, are they going to screw up when I put them on the phone? Probably, but a heck of a lot less than if I just put them on the phone cold. And they'll at least have the confidence to go, yeah, I have an idea of what it is I'm supposed to be doing. This is completely underused. There's also a bit of a fallacy in the sense that people think, well, if I drilled it once, I don't ever have to drill it again. Absolutely not true. There's nothing wrong with repeated drilling to continue to perfect somebody's skill set. And to that end, if you look at when you were in your professional training as a dentist, you didn't learn how to do a restoration or prepare a composite and then just go work on a live patient first. You practiced before you did that. That's the whole point. Do you see? I know I'm short-circuiting that a lot. But you don't just start a person off with the real thing. You bring them up to the point where they can do it. So how would I get somebody to, flatten this concept? I don't like meeting new people, whatever. Practice meeting a new person. You might do it with your dental assistant. You might do it with your office manager. You might do it with a friend. You're meeting a new patient for the first time. You'll come up with a comfortable way in your own words that you can do this over and over again. I've told this story before, but I had a client whose associate felt like this. So he actually practiced it with him for an hour. And he was the patient. The owner doctor was the patient. The associate was, being themselves. And they did it over and over and over and over again until the associate felt comfortable, and then it was no longer a situation. You could even extend this if you want to practice this skill set, when you go to an event. Make it a point to go meet people. Introduce yourself. It's something you eventually get used to. Funny story in a sense, early in my career, I was doing some marketing training. And part of the marketing training was you had to go out and do actual surveys, because surveys are a great way to make sure your marketing is spot on. You don't want to just send stuff out blindly, which a lot of people do. Anyway, so we're going out, and we were supposed to go out on the street and just survey random people. And it's funny, the reaction you get from the class is so crazily variant. Some people are like, sure, I'm going to go outside and talk to people. Other people are deathly afraid. That's the last thing they'll want to do. They feel sick. They don't want to go out today. But what's funny, if you take the people who were petrified of doing it, who do they go and survey first? They go and survey the most non-threatening person they can possibly find. Here's this nice, sweet-looking old lady, and she's not going to yell at them. So they start with them. After a while, they get so used to it, they're going up to the guy who's sitting on a Harley full of tats and, looks like he could, mess somebody up pretty bad, and surveying him without a second thought about it. I think we tend to build up in our mind that people are a lot worse than we think they are. A lot of people are just cool and they're nice. Sure, there's some, bad eggs or whatever, but most people are fairly cool and decent, just like you are. So this is something you practice. You practice it, you practice it, you practice it. Now, unfortunately, if you're an owner doctor, you're having to do this anyway, but the more you practice, the more confident you can become. You do what you did during your drilling, you try it, you start to see some success, maybe you go back and you work on a few things, and eventually this becomes easier. Like I said, ultimately the big time solution or the full solution is to do a communications course, and I have that link up there, but that's how I would handle it now. All right, so that's the first point. So what about this? What's the second scenario or stage? Let's say I have somebody who can interface with people, but they're not good at explaining things. They're not good at explaining it in a way that it's communicated in a way the person can actually receive it, the patient in this case. They can't really estimate what the person really knows, so they're talking to the patient as if it's another medical professional. So here's what I would do for this one. You want a non-dentist for this one. And preferably not even, your spouse would be a good stand-in, but your spouse has a degree of familiarity, unless they don't, right? You ideally want somebody who knows nothing about dentistry. All they know is that you're a dentist and you're their friend. And you ask them if they can help you with this. You just want to get better explaining dentistry to non-dentists. And then you start explaining the procedures that you do, especially the procedures you'd like to do more of, maybe more restorative or prosthetics or implants or whatever. Explain what the procedure is, why they need it, and when the person's listening to you, tell them, listen, if I go over anything that you don't understand or you feel like you're getting into the weeds or whatever, stop me and tell me, what is that? Like you start getting into, the pulp is necrotic with a periapical radiolucency when you're explaining endo, then you go, wait, what are you talking about, dude? You need to have somebody who's going to be honest with you and tell you if you're explaining things well or you're not explaining things well. And then you'll figure out a way to explain it in a way that is accessible to somebody. The nerve inside your tooth is dead and infected. Cleaning it out stops the pain and will save the tooth. The point being is this tends to be an issue. People tend to get very heavy with technical terms because that's how they're used to thinking and talking, especially with the staff. So practice explaining these things until you could explain it to anybody, especially somebody who has zero dental background whatsoever. Focus on the procedures that you maybe have the most difficulty explaining to patients or procedures you'd like to do more of. Okay, and this is also helpful too if you end up doing social media videos and things like this, or you want copy for your website. This is the language you're going to want to speak in, is language that everybody can understand because that is who your public is. Your public is not other dentists or dental team members. All right, so that's stage 2. Let's take stage 3. We have a person who can interface with people pleasantly enough. They can explain procedures, but they get uncomfortable asking people to do certain things, like you have to come in at this time, or here's how much this is going to cost, especially financials, right? Now, if you've listened to the podcast for any length of time, you know that we're a big proponent of the doctor should explain the fee to the patient. You might go, why? The doctor shouldn't have to do that. Their relationship with the patient should just be as a doctor. I have staff who does that. Cool. That's the way it's always been. The reason why this works better is a patient is most likely to listen to the doctor in a dental practice. And if you don't believe me, ask your staff. That's who a patient is most likely to listen to. Your word commands the most, has the most command value. How's that? So when you go over the fee, that means a lot more to the patient when it's just you've gone over the treatment and you send them off to your treatment coordinator to tell them that it's going to be $15,000 so they blow up in the consult room when you're not there, you see. So if you have trouble discussing financials, there's a number of things you can do. It's part of the sales hat, which is one of your hats, so you have to wear it. And you could do this for, let's say, you have an office manager who has this problem or a treatment coordinator who has this problem. Like, they're giving the fee and they seem embarrassed. I would have them practice it. You could start off easy. Practice in the mirror. This treatment plan is going to cost $14,000. Then I would practice it with your OM or your assistant or your treatment coordinator. And if you're the doctor owner, let's say this is something you haven't been good at, but you have an OM or a treatment coordinator who is good at it, that's even better because then they can sit across from you. And you can say, you've gone over the whole treatment plan. Let's say you're just practicing the financial part. You go, okay, well, do you want to do this treatment plan? Yes. Okay, good. Well, the treatment plan is going to cost $14,000. And then they'll be able to give you realistic objections that patients have given them before. Now, the only caveat I'm going to add there is they can't just bring up the objections that horrible patients, the couple of horrible patients who were nasty to them brought up, because that's not the norm. We want to go over the normal objections. Wow, I don't know how I would pay for that. I didn't think it was going to be so much money. Why is it so expensive? These are the kind of objections you're going to want to hear, the ones that they've actually been able to resolve, not the irresolvable objections, which is, again, it's another peculiarity I've seen. When I have people doing exercises in a group setting, and, one person is supposed to be the patient, they're being that patient that they could never close, or that patient who gave them a hard time. Those patients are the small minority. They're not the majority of your patient base. But then, a good chunk of your patient base is going to give you some pushback when you explain what something is and how much it costs. They're going to ask questions. Why is this so expensive? I don't know how I'd pay for something like this. Those are the type of objections that you want to have a command over handling, because those are going to be the normal ones that you hear quite often, right? But the thing we're trying to resolve in this step is get you comfortable explaining the fee when you can do it without feeling that nervousness in your pit of your stomach, or that upset or that worry, or, oh my gosh, what is this patient going to think of me? Once we can get you over that, which the only way you're going to get over that is drilling it and then eventually doing it. After you've drilled it and done it for a long enough time, you're not going to even think about it. It's going to become second nature, and it will increase your treatment acceptance. I'm telling you, this is just something I've seen over and over and over again. And if you feel like, oh, I can't, you can make up all kinds of reasons why you can't do it. Look, I could make them up with you, but there's really no reason. You should be able to do this. And if you can't do it or you don't do it, drill it until you can. It will make a huge difference in your office. All right, which brings us to stage 4. So we've got somebody who can do all of these things. They can mention the fee. They can give explanations that the patient can get. They're comfortable relating to a patient, etc. But they have trouble handling specific objections. A specific one. There's sort of like your kryptonite objection you just don't know what to do with. I want to speak to my spouse, or I need to think about it. Well, then I would practice how to resolve that. Now, I had a whole episode on this, episode 82, where I went over how to handle specific objections, so I'm not going to rehash that. If you want to check it out, you can check it out. I forget the name of the episode, but it was episode number 82. But I'll give you a few examples. Like, let's say, for example, anytime a patient tells you, well, this is great, but I'm going to have to talk to my spouse. Well, what do you do? What would I do? It depends. Someone telling me they need to speak with their spouse could mean one of two things. That could be a real legitimate reason they can't do it right now, or it could be a way for them, it's just basic sales resistance and they're trying to blow me off, which we all have that, sales resistance. So how am I going to find out? Well, the first thing I would check is, well, look, if it were up to you, would you want to do this? Yeah, absolutely, I would do it in a heartbeat. Okay, so what would happen if you went ahead and just did it? And this is where I'm going to get my valuable information. Look, I would love to just do this, but my wife and I have an agreement that we don't spend over $1,000 without talking to each other first. So this treatment plan is $4,000, $5,000, whatever it is. So I have to talk to her first, or I'm going to be sleeping outside. This isn't going to work for me. You go, okay, good. Well, then you have a couple different options at that point. You could go, all right, well, what do you think she's going to say? Oh, she'll probably just tell me to do it, but I just have to give her the courtesy of telling her. Now, some people at that point might go, well, do you want to call her real quick? Some people don't want to do that. I don't really have an opinion on either way. To me, it's situational. The person might offer to call the spouse at that point. Or I know if somebody told me to call my wife, maybe I'm going to do it, maybe I'm not. I'm going to go, look, you know what? I'm just going to talk to her tonight when I get home, right? Really depends on the situation. Or let's say you ask, well, what do you think that your wife's going to say? And they go, oh, well, she's going to look at the dollar figure, because that's the one thing she is going to understand. She hasn't sat with you for the last 20, 30 minutes while you explain this to a patient. They might go, oh, she's going to freak out about the amount of money. Then you might go, look, let's do this instead. We've just spent 20, 30 minutes. The most important thing to me is that you get the treatment, because you need this. So we've just spent 20, 30 minutes together explaining it. So you want to do this, right? Yes. Okay, good. So here's what I'd be willing to do. If you want, I am more than happy to re-explain this to your spouse. I can do it over Zoom. You could bring her in if you'd like, and I'd re-explain it. You tell me what works on the schedule. And to a patient, that actually means a lot. You, the doctor, is willing to open up your schedule to just sit down for free and talk to them again. And the great thing is, if the spouse isn't a patient, you might get a new patient out of this, whether you're doing it over Zoom, which I don't know if it's HIPAA compliant or not, so they'll leave you to figure that one out. Big disclaimer here, I don't know. So I leave that to your responsibility. Or you do it in person, you have the potential to get a new patient out of it. But the point being is, you're taking responsibility for the patient, and are you going to have some of those which don't make it? Absolutely. Some of those the person's not going to buy. It happens. You're not going to close everybody. It's just a fact of life. But if you can keep that percentage of closing high enough, 80%, 70%, you're in pretty good shape. Now, let's say I'm asking those questions. Do you really want to do this if we're up to you? Well, I don't know. Well, then the wife objection really isn't the issue here. The issue is the person isn't closed. Or if I go, hey, I'm willing to talk to your wife, if she's going to say, no, like they're just shutting down. There's another objection there. This isn't the real reason. This is just a way for them to get you to back off. It's very similar in a sense to when somebody says they want to think about it. If somebody tells me, I've just explained what they need, and they go, well, let me think about this. What are they actually saying? They're saying no. It's just a nice way of saying no. Not very often do you explain something to somebody and they just go, no. Nobody does that. They're going to say, I want to think about it, or, this just isn't a good time right now, or I'm very busy. I don't know if I can afford this. These are the things you're going to hear. So if someone says they want to think about it, I could go one of two ways. I could go, okay, I'm just meeting sales resistance here. They're not closed yet, and go back into explaining the treatment plan, in which case I would acknowledge their objection. Very important. I want to think about it. I understand this is a big decision. Now, can I show you one other thing? Sure. Look, now I want to just show you what's going on with this tooth here. Like, you go right back into it. That's one thing you could do. Or what I've done, if somebody says, let me think about it, I'll go, look, my job as your doctor is to get you healthy. I would love to do it now. If there's a reason we have to wait, we can take a look at that. But the most important thing for me is that I get you healthy. So what I have found is when people tell me they want to think about it, there's something else on their mind, and they feel like they shouldn't say it, or they don't feel comfortable saying it, or they think I'm going to react badly to it, but I'm not. I'm here to help you. So what is it that you're concerned about? Just tell me. It's fine. And we'll see if it's something we can't address. And they may go, look, I hate getting shots. I hate needles. And the drill, I hate the sound of the drill. Well, now you have an actual objection that you can deal with. It's not just this big, nebulous, I want to think about it. Or, oh my gosh, I had no idea it was going to be this expensive. Okay, well, let's take a look at that again. Whatever that might be. But the point I'm making here is take that objection that you're having trouble with, and again, ask your dental assistant or office manager to sit down with you and practice handling that objection until you are comfortable. And then the next time you get it, you use what you practice. Now, it may fall on its face, but at least you didn't feel flustered or confused. And you go, okay, I got to work on this one a little bit until I can get better at it. And obviously, the solution for all of this is formal training. Things like that communications course I talked to you about, or those communication and sales seminars, which I have those links, third shameless quick plug, on the episode webpage. That's the ultimate solution for this, where you actually, make these skills your own and are able to actually be effective with them. But in the meantime, what I would do is take things like this, drill them, practice them, and this is just sort of an overall viewpoint. You can do this with any part of your skill set. Be willing to look at where you need work. The toughest part for anybody is to look at what they're not. It's easy for us to look at what we're doing right. But what we tend to do when we're doing something wrong or we're not effective is we just beat ourselves up. But I want you to put yourself in an interesting position here for a second. If you had a friend who came to you and said, whatever your name is, I have trouble handling money, would you tell them that they're a piece of garbage and they're not very good and they're just dumb? No, but that's what people do to themselves. Well, I'm just dumb and I'm not. Why would you treat your friend better than you treat yourself? Don't you think you should be your own friend to a degree and at least have some equality there, treat yourself well? So if you're not good at something, don't immediately go, wow, you're just a piece of garbage. Go, okay, how could I get better at this? And, it's the one thing that's kind of saved me over the years. When I started lecturing in 1998, and it's actually a funny story, my wife and I were partners in a company way back when. And she told one of the other partners, oh, Jeff's a great seminar speaker. And I'd done like limited study club meetings. I was not a great seminar speaker. So she told me this, and I went, thanks. Thanks a lot, hun. And she said, okay, good, we're going to work on this. So I practiced lecturing in my living room for probably 30 hours until I got it up to the point where I could go on stage and be okay. And she was a brutal coach. You're doing this, you're doing that, quit doing that with your hand. Why are you putting your hand in your pocket? Like, she was just all over me until I got to the point where I could actually present. And then, over the years, as I started speaking out, we do evaluations at the end of the seminar. I look at those evaluations. And if there's anything that I can improve, because sometimes you get stuff you can improve and some is very subjective. But, when Jeff did the drill, the room was not controlled very well. Oh, that's a good point. I should actually control the room a little bit better. I worked on those things until I became better and better. It became second nature. And then I've done it for, 10,000, 15,000 hours now, and I'm better at it, right? This is my flex moment of the podcast. But the point being, the reason I'm saying that is not to flex. It's to go, listen, you could take anything you want to get better at. If it's important enough to you, practice it. Especially if you're practicing it the right way and you can get better at it. Nobody is not able to sell. I could teach anybody to sell if they have the determination to learn how to sell. And this is something that has application outside of sales. You can do this with your team when you're teaching them to handle the phones or interface with a patient or collect money or whatever it is you want them doing in the practice. Assistants doing certain procedures. You practice it, you practice it, you practice it, you practice it. You put them out in the real world. They mess it up. You practice it some more until the person is, their performance levels up to the point where even they're amazed at how well they're doing. Anyway, this is something you can do in this new year, 2026 here. You do it, you get better at it, and you'll see more and more success. I do hope this helps. Let's have a great 2026. If you want to know more about MGE, you can find us online at mgeonline.com or call us at 800-640-1140. Don't forget to have those links on the episode webpage. Folks, have a great week, and we will see you at the next episode.